La 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 la.
This is the Mid-Morning Talk with Julie Alli.
And on to the final interview for the day. We are privileged to be talking to Fatima Hassan, founder and head of the Health Justice Initiative. We're going to be talking about the rollout of the COVID vaccine. Fatima, assalamu alaikum. Welcome to the program. Thank you indeed for being with us on the show.
Sure, it's a pleasure. Wa alaikum assalam.
Tell us about the Justice Initiative. What's it all about?
So we started the Health Justice Initiative in June 2020, largely in response to the pandemic, because we obviously saw the early signs of the similarities with the HIV/AIDS crisis and its issues that many of us had worked on before. And so, the idea is really to focus on issues of intellectual property and patent barriers, and to how profiteering actually, cost us equitable healthcare. And so that's why we now have a focus on vaccine equity in the country.
Okay, so now the rollout's going to start. I think there's two trains. There are two issues that I do want to cover. The first is the resistance, perhaps, and then also those people who are wanting to be vaccinated, but they're right at the bottom of the queue, and then the funding around this. If government doesn't have enough funds, if my medical aid's not going to be paying, how do I get the money to get the vaccine?
Okay, so
lots of questions.
Let's start with the easy question. So all medical schemes in the country will, by law, now make the vaccine available to all of its members through what's called the prescribed minimum benefit. That just happened in the last few days.
Wow.
In addition, and so I think that's really important because it's also a commitment to the principle of social solidarity and equity. In addition to medical schemes, the private health sector will also come on board and co-contribute funding, so that if you don't belong to a medical scheme, or if you're a person who's lost their job and so you've left a medical scheme and you rely on the public health sector, or you rely on your ordinary GP for healthcare services, you will also be able to access it. And the vaccine will be free at the point of delivery, so a medical scheme member won't have to, put extra money on the table, nor would somebody who goes to their GP or somebody who relies on the public health sector. And so that's what we call the mixed funding model. There will be different sources of funding from the private health sector, medical schemes, government, and potentially also from some philanthropists, including the Solidarity Fund. So the idea really is around equitable acquisition and allocation, as well as social solidarity. It's really unprecedented. We haven't seen such kind of action, definitely in the last 25 years. Normally the private sector sort of has its own programs and does its own procurement. But in this particular case, there's actually going to be a central point of funding it, a central point of acquiring it, and then a central point of allocating it. So if you are under 65, if you don't have any comorbidities, if you're not a healthcare worker, you will wait just in the same way that everybody in that same profile will wait in the private sector. So your wealth, your religion, your money, your race, your gender, in this time with this vaccine, unlike any other condition we've had in our country, you will wait like everybody else, and you'll be subject to the same rules and criteria, which I think is important.
How are the role players, the people that are going to manage the rollout, know that I fall in category 2 or 3, for example? How are they going to know this, and how are they going to identify me and communicate with me to make my appointment to receive the vaccine? I mean, I'm just trying to think about the logistical nightmare, of the rollout of this vaccine.
Yeah, so
if not managed properly, obviously.
Yeah, you're right. And I think those are the questions you have to direct to government, to the National Command Council and the National Department of Health. We haven't had a massive rollout vaccination program in this country since, I think, the polio vaccine. So it's quite a, Herculean task. It's a logistical challenges definitely will be there. Some of the vaccines also need cold storage. Some of the vaccines require 2 dosages. So you would have to find people to come back after 2 weeks or after 21 days to get the second shot. That's if you use the 2-dose vaccine. So there's various issues around how you're going to actually manage a vaccination program where you are using multiple vaccine products from multiple companies because of the limited supplies issues. So we potentially could be getting 3 different vaccines. And we're also prioritizing different populations in our country, starting off with healthcare workers in phase 1, and then frontline workers, those with comorbidities over 65 in phase 2, and then anybody else is over 18 in phase 3. And because the vaccine won't be mandatory, there's going to be attention is going to have to be paid on how do you try and convince people to take a safe and effective vaccine or vaccines, depending on which one's available, and also how you're actually going to identify them in communities. So there's a very strong public health contact tracing system, which potentially could be used. And then medical scheme members would probably also get communications and people who rely on their GP. So one assumes that there's going to be a national communication program and campaign around how and where you'd be able to access your vaccine. But certainly this information is going to have to also come from our mosques and our shuls and our temples. It's going to have to come from the places where people frequent, like schools, universities, their pharmacies, their GPs. So there's a lot of role players that are going to have to be brought in into this equation. Potentially, even if you go get a burger at McDonald's, they should be telling you when the vaccine rollout is going to take place in your community, or who the next priority groups. So I think it's all hands on deck. You have to vaccinate between 40 to 50 million people within the next few months. Our front line is being decimated. People are getting sick. People are dying. So it really is urgent. And so, the logistical and administration aspects are going to definitely require a lot more attention.
So, Fatima, you as the Health Justice Initiative, what's your focus at this point in time? I think we can, as South Africans, sigh with relief that finally the vaccines are here. Never mind the naysayers who believe that this vaccine was produced in a very short space of time. How effective is it going to be? There's talks about altering of the DNA. There talks about other side effects. There's talks about what's happened abroad. Perhaps one in 10,000 people had some sort of a side effect. And I guess the rumor mongers are, going to town with these type of stories. So let's look at your role and how much are you going to be, your organization going to be in the front line till the bulk of the population has been vaccinated. What then?
So thanks. Our mandate is to make sure that we have an equitable acquisition and rollout plan, and we in the early days of that. And so I think that's important because it has to meet certain constitutional standards that everyone everywhere who needs access to a vaccine can actually get it. We're certainly working with a lot of partners in the South African as well as regional and global space to deal with the issues of disinformation, which is actually going to cost us lives. We know this from the HIV/AIDS epidemic. When false information is sent out, it basically means that people don't seek treatment early enough, and they won't necessarily want to get a vaccine that is actually proven to be safe and effective. We have a very strong regulatory authority in South Africa called SAHPRA, and they will only register a vaccine that is safe and effective. They haven't as yet because they're still reviewing all the clinical data. There's some data that's still outstanding that's coming from other companies. So, I think we can take some kind of confidence in the ability of our regulatory authorities to cut through the data and to review that in an independent way, because the Department of Health has no power under our law to put pressure on a regulator to approve something, for example. And so this will be dealt with by clinicians who are highly regarded in our country, by scientists and by doctors, and they certainly will not approve a vaccine that's not safe and effective. The issue emerges when you have different vaccines with different efficacy levels. So it will really be a policy decision for government to decide, are you going to use a vaccine that is only 60% effective? Do you want to use a vaccine that's 90% effective, 70%? And because of the limited supplies and scarcity, at the moment, we're in a situation where we're trying to get whatever vaccine we can get our hands on. So we now know that 1.5 million dosages, potentially for all the healthcare workers or on the front line of healthcare settings in our country across public and private sector, will be coming in from the AstraZeneca vaccine, which is being manufactured through a company in India called the Serum Institute. We now know that the president has said 20 million more dosages are coming. We don't know from where or which vaccine, and so that's uncertain. And last night, the president announced that Africa, through the Africa Vaccine Acquisition Task Team, has now secured 200 million dosages, also from AstraZeneca AstraZeneca from Pfizer and Johnson & Johnson potentially. So, I think, and that's important because even if we vaccinate our entire population in South Africa, if Zimbabwe doesn't and Namibia doesn't and they can't get access, we can't have regional herd immunity, and then we can't have global herd immunity. So even if Canada vaccinates its entire population and the whole of Africa can't or doesn't, then you won't actually have global herd immunity. And so the mutual interdependence, I think, is a very important part of trying to convince people that the vaccination would be safe and effective, and it's actually something that could take us out of this pandemic.
So for now, we as South African citizens just sit and wait, sit tight till an announcement is made by perhaps your organization or government to suggest that the vaccines are here, and or your medical aid will get in touch with you and tell you where, when, and how to go about to get the vaccines. I should imagine lots of GPs will be involved in the initiative as well, because if you are going to be vaccinating hundreds of thousands of people, 40 million people over a period of time, you're going to need the manpower to make sure that it happens.
Yeah. You're right. So government has already said that they're going to appoint about 6,500 dedicated special workers who will be basically vaccinating up to 50 people a day. I mean, the targets are quite ambitious. You have to vaccinate hundreds of thousands of people in the next few months, and then millions. The idea is if you want this pandemic to be over by the end of 2021, you've got to vaccinate the whole world basically by the end of 2021. And so that's billions of people. And we certainly are not the only country dealing with how are we going to do it, when are we going to do it, who's going to help us to do it. Humanitarian organizations are going to have to help, like Gift of the Givers or Médecins Sans Frontières, for example, your local pharmacies. So there's talk about setting up national vaccination centers using potentially the IEC, like our elections infrastructure. There's talk of using parking lots, local pharmacies, big chain pharmacies, every hospital, every clinic, every GP, like you said. And so that's really what it's going to take. There's going to be mobile vaccination clinics, according to government, and we have to see what the provincial spread of that will be, because many of our people live in parts of the country which are very remote, and obviously there'd have to be dedicated focus to how you set up the tents and the different kinds of vaccination centers in informal settlements, because it's not a suburb and it's a different logistical setup. So it's a lot of work, and I really don't envy all of our, frontline healthcare staff who are going to make sure that this is a success. But what we can do as citizens and as people who live here, and as people who are committed to making sure this pandemic ends, is to help with not spreading disinformation and to help with not spreading false information, because that could cost somebody their lives, basically.
Absolutely. So in the meantime, we'd like to thank you indeed, because you certainly have brought some hope and some good news to all of us. We talked about the acquisition of all of these vaccines and the fact that government and your initiative, your health justice initiative, is behind this, supporting this initiative all the way. How soon, now my final question, how soon do you think we'll see the rollout happening? I think people are waiting, those that realize the importance and just the weight of COVID-19 globally can't wait to be vaccinated so that they can sigh with relief and hope and pray that they are safe and their loved ones are safe as well.
So, we certainly support the idea and the notion of equitable allocation, but we don't support government in all of its efforts. We feel that it's taken too long. There's certainly more that it could have done and it should be doing. And we certainly, take issue with the role of the pharmaceutical industry that has, yes, they've accelerated the research, but they've done it off the back of public trial participants and subjects of these trials, as well as technologies and research that was done previously by Ebola and HIV research, and there's been a lot of public investment in this trial. So it is unprecedented, you're right, that there's been this rapid, accelerated research, so that, within the space of 9 months, we only got the first approvals in December. So this is just like 4 or 5 weeks ago that we finally got approval in other parts of the world on vaccines. It's not like this has happened, many years ago. So it's moving very fast. We now have confirmation that some supplies could be coming, but we don't know when exactly. And when it does, we'll be able to monitor that. And so things are moving quite fast. I think in the next 4 to 6 weeks, we'll have a better sense of what's actually happening. What are we able to get our hands on? How much are we paying? Where can we manufacture quick vaccines for the rest of the world as well? And then how are we going to roll it out in our country? The minister just made his presentation about.
Okay, the picture has frozen there. Let's see if we can get Fatima back online just to finish her train of thought. Very important information that you're sharing with us, and very obviously, apart from being important, life-saving for those of us who have loved ones suffering from this disease. And we can't, it couldn't come, the vaccine couldn't come a moment sooner as far as we're concerned. Back to you, Fatima. Can you hear me?
Yes, I can. And so that really is my final. I think that a lot of the details will be fleshed out in the next few weeks as well. And we're certainly calling on government to be more transparent and to share information in a more timely manner.
All right, the one thing I'm going to really leave this as the final question. I think a lot of people are a bit nervous about the fact that we might have a situation of corruption, corrupt practices around the vaccine in terms of money making. How does your health justice initiative, and it's huge, it's a huge task for you guys to be undertaking, but who's going to monitor or police the fact that no one is, involved in corrupt dealings as far as the acquisition of the vaccines are concerned, and corrupt officials don't enrich themselves in the process?
Yeah, and I think that's a valid, question and a concern for people to have. But the problem is that the lack of transparency in the pharmaceutical companies in terms of their pricing is making it very difficult for us to figure out whether we're paying too much or too little. There's 4 price going around, one for the EU, one for the US, one for COVAX, and then for the bilaterals that we're all dealing with. And now that Africa has secured some supplies, we don't even know what prices they're paying. So, corruption is a two-way street as well. Somebody has to enable it, somebody has to be on the receiving end. And so I think our focus has to be on both the public and private sector in trying to see whether there is any potential for corrupt practices. It's harder when you do vaccines because there's limited suppliers and limited supplies, and it's part of a very complex medicine pricing regime. The potential for corruption could be in the storage and the distribution facilities, because I think a lot of people will be trying to, create the facilities and try and get the contracts so that they can store the vaccine, they can transport the vaccine, and then they can administer the vaccine. And I think those are the areas that we certainly will be looking at. But for now, it's all speculation. We first have to get the plans, we actually have to get the supplies here, and then we'll monitor whether there's any corruption in the actual administration of the vaccine.
Okay, now if let's just look at the perfect world post-COVID-19, everything's okay, the world has been healed. Where to for Fatima Hassan and the Health Justice Initiative? What would be your next step?
Yeah, so unfortunately, even if we all vaccinated and get global herd immunity, the world will not be safe and the world will not be fine. We still have a HIV/TB crisis. We have a cancer crisis. If you're living with cancer, if anybody in your family is living with cancer, you pay too much for treatment, you pay too much for medicines, and because of our public health and private sector disparities. So the idea of health justice is that we've got to move away from this notion that health is a commodity. It's not an iPhone, it's not a fancy car, it's not a PlayStation. Medicines are really there to save people's lives, and they need to be more affordable and accessible. And so certainly, even if COVID, is just a normal, manageable, seasonal, chronic condition, we think that the road ahead is even going to be harder, because the way in which companies and the way in which many governments have behaved, even in this pandemic, when it's been so severe, when there's been such a crisis, where profiteering is still such an important element for people, that means that when we want to deal with what's post-COVID normal issues like cancer or TB or HIV or diabetes, that the battle's going to be even harder. Because if in a pandemic you can't commit to some kind of standard of human solidarity, then I don't think we'll ever get that, right? So yeah, that's the next step for us.
Okay, let's leave it there. Thank you indeed for your time. Thank you for all the information. It is really encouraging knowing that hopefully in a couple of weeks' time that we as South Africans will have the opportunity to heal ourselves and hopefully heal the world. Assalamu alaikum to you. Thank you indeed.
Wa alaikum salam.
It's exactly 1:00. Thank you indeed for being with me on the show. I sincerely hope you've enjoyed all of the interviews as much as I've enjoyed your company. Till next week at the same time. As always, stay safe, social distancing, mask up, and keep washing those hands. Till the next time, as always, Assalamu alaikum and Khudafiz from me, Julie Alli.